Hi, I'm Dr. James Whillans at LifeWorks Family Chiropractic. I'm the clinic director here, and I really want to just thank you for choosing our office for your healthcare needs. And I also want to recognize you. You're the type of person who is taking the time to watch this video. You obviously care about your health. Your health is a top priority, and you're the type of person who's going to do whatever it takes to get the best results. And that's really what this video is about. What I found over the years is that the patients who get the very best results, they really understand their condition. They take the time to understand what's happening so that they make sure they know what to do to get the very best results. And today we're going to talk about not your condition specifically, because every patient who comes in here has a different spine and nerve system, a different pattern of interference, and everybody gets a unique, tailored adjustment for their needs. However, there are some principles about understanding a normal nerve scan versus abnormal nerve scan, a normal X-ray versus abnormal X-ray, that you'll need to understand when you come in and look at your test results. So let's jump in, and we're going to start to talk about what we found. Now, as you probably know, long before you met us, your brain controls your body. Not just your heart, but your brain is controlling all of your organs, it's controlling your immune system, it's regulating, adapting, shifting. Your brain is needed for every normal bodily function. Now, how does your brain get signals out to the different parts of your body? That's right, your central nervous system. Now, your nervous system is made of millions of fibers that transmit signals from your brain to your body. And if every fiber transmits information at 100% to every body part, and we treat our body really well, what's our health going to be like? Absolutely, it's going to be awesome. Now, if we cut that cord completely, then clearly we're not making this video and you and I are not having this conversation. What we found with you is a significant interference to your health called vertebral subluxation complex, or subluxation for short. That's an area where there's a disruption, a disturbed, weakened nerve signal along your central nervous system. Now, wherever there's disruption in the nerves and a weakened signal, wherever that nerve goes, that part of the body is not going to work properly. That's called malfunction, when it's just not working right. An example of malfunction would be if a muscle is weaker, if an organ isn't working. You get the point. Now, if we leave malfunction, is it going to get better or worse over time? Well, certainly it's going to get worse. Malfunction leads to dis-ease. What dis-ease means is that the tissues are becoming weakened and unhealthy. If we leave a dis-ease long enough, you can tell where that's heading to. Now, once dis-ease sets into your body will start giving you warning signals. Your body will say, hey, there's a problem. And then, hey, there's a problem. And then, hey, there's a problem. How does your body tell you there's a problem? Absolutely. Symptoms, pain, low energy, difficulty sleeping, all the numbness symptoms. Symptoms are your body's warning signal. Now, most people come to my office thinking that the symptoms are the problem, and they want me to take away the problem and do it naturally with chiropractic. And I think you're starting to pick up on why that just really doesn't work so well, because the symptoms are not the problem. There's an underlying issue. In your case, the underlying issue is interference in your nervous system. Now, one of the options for today is going to be relief care. Relief care is for someone who says, you know what, doc, I understand there's more to it, but for now, let's just take care of the symptoms. That's totally your prerogative. We respect that and we'll do that. Another option is going to be called corrective care. Corrective care means that we work to unwind as much of the underlying damage as possible and restore your health and well-being to the very best of our ability. That process will be doing chiropractic adjustments to remove the nerve interference, to reestablish normal, healthy signals. As we go through that process, what will happen is that the symptoms were typically the last thing to show up, and they're usually the first thing to unwind. But we're going to keep removing nerve interference until your body has had a chance to replace all the old unhealthy cells with just healthy cells. And we're going to keep working until your body's had a chance to transform itself from malfunctioning to functioning overall as close to 100% as we can possibly get it. Sounds great, doesn't it? Now, how do we know if we have nerve interference? How do we know if there's interference in the nervous system? Well, we do objective tests, and we do these tests so that we can remeasure as we go through your care how you're progressing. So it's not just based on how you're feeling, it's really based on the function of your nervous system and the function of your body. So let's go through some of the nerve scans. Now, as you recall from your exam, there was 3 different nerve scans that we did. The first scan is called the heart rate variability, and you had your finger in that machine for about 5 or 6 minutes, and the machine measures the patterning of your heart rate. Your heart rate should be speeding up and slowing down minutely with a certain pattern. If your brain is fully powered up and balanced and adapting moment to moment to moment, which is what health is, then that's going to produce a certain pattern in your heart rate, and the machine picks up on that. Now, if your brain and nervous system have been overwhelmed with the stresses of life, that's going to start to change the patterning in your brain, weaken the signals and weaken the adaptability of your nervous system. That's going to change the patterning of your heart rate, and the machine picks up on that. If your nervous system has been overwhelmed with stress and is actually stuck in a fight or flight stress response, that's going to change the patterning of your heart rate, and the machine picks up on that. Now, all 3 of these scores, our scans, are scored out of 100, with 100 being ideal. If we look at that heart rate variability, we want to be up here in the green. Down is weakening of the nerve system, less adaptability. Over to the left is that fight or flight sympathetic stress response. Now, the next scan is the EMG, or the nerves to the muscles. If your spine is all lined up and your nerves are clear, there's no interference, the electrical tone in your muscles will be the exact same all the way down your spine. If you have areas of nerve interference where muscles will tighten, the spine becomes locked up, then of course the electrical tone is going to be different side to side. And that's what the next scan looks at. On this one you can see here, white is normal, green is mild nerve interference, blue is moderate, and then red would be severe. These are the initial scans of a patient of ours who's been a patient for some time. Now the next scan is the nerves, the organs scan. These are the nerves that control your organs, your blood vessels and your glands. That's called your autonomic nervous system. Now, the temperature on both sides of your spine is controlled by your autonomic nerve system due to the blood vessels. If your nervous system is clear, there's no interference, the blood vessels will be open the same on both sides, the amount of blood, and then the temperature will be the same both sides of your spine. If there's a disruption or interference in your autonomic nervous system, then the blood vessels will be more open on one side, more closed on the other, the blood flow will be different, and then the temperature will be different side to side. Within half a degree is normal. Anything over half a degree is a sign of interference in your autonomic nervous system. This is our patient's initial scan when he first came in, and you can see most things were normal except for he actually had severe up at the very top. Now, when he first came in, those 3 scans were averaged together to give the core score, and the average was 53. And then over time, we've redone these scans. Not only was he feeling better in the first few weeks or so of care, but we kept going until his scan had improved and improved until we got all the way up into the 80s. Now, depending on how long your problem's been there, if it's a very new problem you have, your score will go up quickly. If it's a chronic condition, of course, it'll take longer. Now, let's switch gears and have a look at the x-rays. The x-rays tell us how long the problem has been there. Now, if we did x-rays with you, this is very critical to understand. From the front, on your x-ray, we're going to want to see everything look perfectly straight, nice and plumb straight from the front. Now, from the side, your spine should have a forward curve here in your neck, a forward curve in your lower back, and the opposite in the middle back. The x-rays show me how the alignment is, where the nerve pressure is, how long the problem's been there, and how to make the best correction. This is a picture of a normal spine from the side. This is just their neck like this from the side. So here's their jaw, their head, their shoulders. And from the side, what we can see is the bones are nice and square, this front part of the bone, nice and square, nice and flat along the front and the back. The discs are made mostly of water. They show up as being black. They're evenly spaced. And then their alignment their bones are all lined up in a nice forward curve. You can see they're all lined up, that nice forward curve. That allows for shock absorption. As you walk around through your lifetime, you have this built-in shock absorption system. And the spinal cord sits nice and relaxed like a banana, like so. And the signals are transmitted through clearly. Again, that's normal no matter what age. Now, if we leave nerve interference, muscles tighten, spine's locked up, and we leave it like that and we walk around, the spine wears out prematurely. That's divided into phase 1, 2, 3, and 4. In phase 1, the bones and discs look normal. However, the alignment has shifted and there's scar tissue developing around the spine, which we don't actually see on the x-ray. In this person's case, they've lost the curve. Now with no curve, they don't have shock absorption. So their spine will wear prematurely, and also their spinal cord is going to be under tension. A neurosurgeon named Alf Berg did a study that showed if someone loses the curve in their neck, their spinal cord inside actually gets stretched under tension, and that often didn't cause pain, but it caused a weakening in the signals. If we leave that uncorrected, we get to phase 2. Now in phase 2, you can see that these two bones have been especially stuck because that disc has been wearing down over time. These discs are still normal, except for that one. And you probably can see some sharp bits right at the corners of the bone. The sharp bits are rings of extra bone the body's sending to try to stabilize. So as that disc wears down, the body's smart. It's sending scar tissue, it's sending bone to try to hold things together. The problem with that is that extra bone is starting to grow into where the nerve should be. So the hole for the nerve is starting to get smaller. If that's left uncorrected, we get to phase 3. Phase 3, the disc now has worn further. The body sent even more bone to try to stabilize, to do the best it can. The problem is the hole for the spinal cord is starting to get smaller as that extra bone grows in. That's called canal stenosis. If we leave that uncorrected, then we'll end up here in phase 4. In phase 4, the bones have pretty much fully fused together. Not all of them, but the areas that were injured. You can imagine the person's quality of life, health is clearly deteriorating during that process. Now, one of the most common misconceptions I hear about this all the time, because this process is called degeneration, osteoarthritis, degenerative disc disease, or sometimes just arthritis for short. The most common misconception I hear is that, well, that's just my age. Doctor told me that I have arthritis, that's just my age. Well, here's the problem with that. Let's look at this person. They've got all perfect discs except for that one. Now, if it was age, wouldn't they all wear out equally? Certainly they would. It's not age, it's what trauma, injury, stress has happened to what area of the spine, and was it corrected or not? That's really the difference between going through this process. That's one of the reasons why we check young people and even children, is to make sure that we can correct problems early on before this process sets in. Now, when it comes to your correction, the earlier we catch this, the better. If you're coming in and I show you when you get here that you have a normal spine, we're going to move you almost immediately towards wellness care. If you're in phase 1, 2, or 3, you're going to need corrective care before we can get to wellness, and I'll explain what wellness is in a moment. And if you're in phase 4, there's very little correction we can do. We're going to do our best for relief and try to manage the situation, but correction will be extremely limited, if any. Now, the earlier we catch the process, the quicker the correction is. Assuming that your choice is to do corrective care, the process in the office is called neurospinal rehabilitation. Now, this is a process of taking the bad habit in your spine, in your nervous system, in your brain, and helping your body move back to a normal, healthy habit, or introducing a normal, healthy habit. With each adjustment, there's a few things that happen. One is that your spinal alignment improves ever so slightly with each adjustment. Your brain has an opportunity for a reboot. Your nerves have an opportunity to let go of interference, and your body can begin to replace old cells with new cells, and healing can progress. However, that new habit we put into your spine and nervous system is up against an old habit. Phase 1 is a problem that's been progressing for up to 20 years. Phase 2 is a problem that's been there for 20 to 40 years. Phase 3 is a problem that's been there for 40 to 65 years. This isn't the age of the people, that's how long the problem has been progressing. It's like a snowball rolling down the hill, getting bigger and bigger and building up momentum. This is a relentless progressive condition. And so depending on where you are, there's momentum behind that old habit. So after the adjustments, your body's going to want to go back to the bad habit it had. And so the most critical part is in the beginning, the adjustments will be done with some frequency and repetition. Everyone's recommendations will be different, and you'll find out when you get in exactly, but there's going to be frequency and repetition in the beginning. And if you're up through here, it's going to be for a very short period of time, maybe just a couple weeks. And if you're into here, then it's going to be months of frequent adjustments. Now, once your body has started to take on that new habit as its own, then we can spread out the adjustments and finish out your corrective care. Now, how do we know when corrective care is done? As far as how you feel, you might feel better early on in that process. You might feel it might take some time to feel better, but correction will be done when we can measure. So what we want to see is we want to see a transformation in your health and well-being. We want to see organs that were malfunctioning functioning better. We want to see the nerve scan interference removed, and we can remeasure that. And we want to see we've unwound as much damage as we can from your spine. Now, if you come in and you're in phase 2 or 3, there is some permanent damage. Your spine's never going to look back to normal, but we certainly can stop the damage from progressing, and we can unwind as much damage as we can. I'll explain to you when you come in exactly what you can expect to see. Now, once we see all those parameters are in place, we're going to consider you fully recovered. We're going to celebrate, and we're all done with your corrective care, okay? Now, at that point, we will be recommending wellness. Wellness really is the best part. Wellness means once your spine and nerves are functioning as optimally as we can get them, wellness is a periodic checkup, just to check your spine and nerves, to see if there's any interference, do any little fine-tuning if needed to keep you at your best for life. It's really the best part, it's the easiest part of chiropractic, is maintaining optimum. And if you're coming in here in normal, we're going to be moving towards wellness very quickly. However, if you're into here, of course, we've got some work, some damage to repair before we can get to wellness. So, I'm so glad you took the time to watch this video to understand how your nerve system should be functioning, how we know there's interference, how we know how long the problem's been there. You're understanding the options. One option would be really not to do anything. And certainly the timing for chiropractic, if you've got a problem in your spine and nervous system, obviously it needs to be taken care of. It's a matter of you determining what timing is right. I'm here for you whenever the timing is right for you. I hope its timing is now. If you're concerned the timing might not be right now to take care of your condition, please do come in and speak with me. Let's look at your x-rays, and we can determine what a good time might be. Now, the other option would be called relief care. I mentioned that a moment ago. Relief care is for someone who says, you know what, doc, I really just want to feel better right now. Maybe we'll do corrective down the road. Absolutely, that's your prerogative, and we support you in that. The third option, and certainly what we recommend, what we specialize in, is called corrective care. Corrective care means we fix the underlying problem to the best of our ability right now, and we get you back to optimal, and the choice, of course, is going to be yours. And when you come in, we'll talk more about that. So thanks for taking the time to understand all of this. I look forward to seeing you in the next few days to go over your test results and answer any questions you have. And we'll go through the details of your recommendations. We'll go through the finances and what the costs are going to be. Answer all the questions that you might have when you come into the office. Okay, we'll see you soon.